Huge amounts of medical data are generated across Europe every day. But much of this information isn't maximised to its full potential. The European health data space, launched in May this year by the European Commission, seeks to change that by making health data more accessible to both patients and medical professionals. There are two types of health data. Data related to healthcare is known as primary use. Secondary use refers to information that is processed under strict security and confidentiality conditions, for instance in policy making or the improvement of healthcare products. Sharing medical data is seen as one of the best ways to foster growth in the digital health sector, as it should overcome the current fragmentation of health standards in Europe. In Greece, organisations like the IHE say common specifications will promote business opportunities.
In the European market, the e-health sector and companies face various obstacles. Indeed, the e-health sector constitutes a fragmented market, and that is to the detriment of European citizens, unlike what happens in the United States and Asia.
Currently worth around €40 billion, the European digital healthcare market is on course to keep growing. Companies like Gnomon Informatics, a digital health product specialist, say the coordinated exchange of data would create a Europe-wide market benefiting both patients and business.
Modelling medical data is vital for European citizens, as well as for the rest of the world. A patient can have all their medical data and medical reports on one device. In this way, they can have the data with them when travelling through different countries, and they can share that in any clinic and with any doctor they want.
Improving interoperability between healthcare providers across Europe should also reduce duplication, for instance with medical tests. That should have a positive effect both on healthcare costs and patient follow-up.
In terms of the architecture, the use of a European data space is the right approach for e-health systems. It gives direction, enabling Europe to create an electronic health industry and offer quality services.
Linking medical and digital ecosystems relies on interoperability, allowing IT systems to read, use and exchange data. A semantic data model will be key to bridging the terminology gap between various healthcare software systems. The next step will be to agree on sentence structure with regard to how the information is received. Once fully implemented, the European health data space should open up Europe's health market and enable small and medium-sized firms to work with each other to develop innovative new products.